Looking at the Markets with David Modell.
Hello and welcome to Looking at the Markets with David Modell. I love to find under-the-radar opportunities in the financial markets, and I'm a fan of biotechs, especially ones that have not been discovered by the markets yet, but I think they will soon. This could be a real runner. I'm speaking to Dr. Marco Taglietti, the president and CEO of Synexus, a developer of novel treatments for a range of infections. Dr. Taglietti, welcome to Looking at the Markets, sir.
Thank you, David, for the opportunity to talk about Synexus.
Yeah, I'm very excited about this. If people are interested in Synexus, they really need to go to synexus.com. I will put a link in the description below this video so people can do that easily. Also, if they want to check out the stock, it is on the NASDAQ exchange, ticker symbol SCYX. Now, at Synexus, your flagship treatment candidate is known as ibrexafungerp. That's a mouthful right there. Now, this has the potential to be an essential therapy in the treatment of multiple serious fungal infections that are sometimes difficult to treat or even life-threatening. Can you elaborate on that, please?
Absolutely. That is, ibrexafungerp is the first representative of a new class of antifungals. And there are so few antifungals currently available on the market that we believe that our product, which has great versatility, a broad spectrum, can be really utilized in a broad range of conditions of fungal infections. Fungal infection can range from difficult to treat community infections, like, for example, vaginal yeast infection or vulvovaginal candidiasis, to hospital infection, invasive fungal infections of the bloodstream and internal organs, where in these patients who are usually immunocompromised, the fungal infections has a mortality that can easily range from 20 to 50%. So we are very proud actually to develop a novel product in a novel class that has actually the possibility of being the first new class arriving on the market in over 20 years.
Wow, that's impressive. Now, there's a serious threat. Speaking of threats, an urgent threat, I would say, Candida auris, I probably butchered that one, multi-drug resistant and with a mortality rate of up to, 60%. I can't believe this, in certain immunocompromised patients. So how does your product candidate address this serious issue?
First of all, you are putting your finger on a real major issue. Right now, everyone talks about COVID, and rightly so, because let me say it's a pandemic that really is devastating the world. But Candida auris is another important infection. It was identified for the first time in Japan in 2009, has been spreading across the world, slowly arrived in the US around 2013, 2014. It has already infected thousands of patients with mortality, as you mentioned, of about 60%. Why this pathogen is so dangerous is because it's naturally resistant to many antifungals. And therefore, there are very few tools to fight this type of infection. And this is also explains the high mortality. With ibrexafungerp, we have shown, first of all, in vitro, then in vivo in animal models, and more recently we started a couple of years ago a study to assess the effect of our drug, of our antifungal against Candida auris. That is the study that we call the CARES study. In this study, we plan to have actually very soon an interim analysis to look at the results. At the beginning of the study, so we are talking back in 2019, we had one of our investigators that treated the first couple of patients with our product, showing that our treatment was very successful in treating the first couple of patients with Candida auris. So we are very optimistic that ibrexafungerp can become a treatment, a successful treatment for Candida auris.
Sure, this is potentially life-changing for so many people. It's really underreported. Now, your company had a first NDA, that's new drug application, accepted in the fourth quarter of last year. This is actually fairly fresh news. Can you tell me more about that, and what's the significance of the NDA?
Yes, and let me first of all stress that ibersafongerp, as I mentioned at the beginning, has very great versatility. So we are developing it both in community type of infections and also in hospital infection. In community infection, we are using it for the treatment of vaginal yeast or vulvovaginal candidiasis. This is a very common infection, actually, that affects probably 75-80% of women will experience some kind of vulvovaginal candidiasis in their lifetime. And so we have a program that we completed in April of 2020 to assess the efficacy of the product in vaginal yeast infections. It was called the VANISH program. We submitted an NDA at the end of 2020, and in December, FDA accepted the NDA, so giving us a PDUFA date, so a tentative date for approval of June 1st, 2020. So we are less than 4 months from the approval of the product, and in fact, we are now at this transition stage in which we are getting ready to launch our product in the second half of 2021.
Yeah, that's exciting, and that could be a real catalyst for the stock. Again, the stock is trading on the NASDAQ, should be available through most brokers if you're an investor, if you choose to learn about this and even possibly buy some shares. SCYX, the stock, as we're recording this, it went up 11% today, and the stock price has been so much higher than that. I see huge potential gains. No guarantees, of course, but this is really exciting. Planned U.S. commercial launch sometime in the second half of 2021. So what is coming next as far as you have the commercial launch, but what else is coming down the pipeline for SCYNEXIS?
Well, the approval that we expect in June will be just the first approval. We expect by the end of this year to have another phase 3 program being completed, CANDLE, in the prevention of recurrent vulvovaginal candidiasis. So we expect another supplemental NDA by the end of this year with another approval in 2022. Additionally, we expect to have a interim reading of our study in invasive fungal infections like the one in Candida auris, and also in another study where we are assessing the efficacy of our product in refractory invasive fungal infection. Refractory because are infections that do not respond to currently available treatment. So we are providing our drug to patients who have no other options. It's a salvage setting, and we showed already at the beginning of 2020 in an interim reading of these results a great response. In fact, in these patients who did not respond to currently available treatment, we were able to see a response, a clinical benefit in almost 85% of them, with about 60% of them having a complete or partial response. So very positive, very encouraging findings. So we will have another reading this quarter. And additionally, this quarter, we start the phase 1 for our intravenous formulation, because the product so far has been developed as an oral product, which is actually what the medical community is looking for, an oral antifungal. But we believe that having also an intravenous formulation can allow our product to be given to patients that for one reason or the other cannot assume a drug orally. So we have in the next 18 months, we will basically get 2 approvals, one in June of this year, one sometimes mid of next year. We will have the results of our hospital program, and we will start also the development of our intravenous formulation. So a significant number of activities that will allow us to maximize the value of the product.
Sure, and maximizing shareholder value as well. Multiple milestones potentially this year or even in the second half of this year, in the coming months. Fantastic. I've read that there are 10 years, a full decade of U.S. regulatory exclusivity and a patent up to the year 2035. Can you tell me about that?
Well, once the product is approved and you start to commercialize, as you know, the most important thing is, and the most important factor is to ask how long is the product protected. We have 10 years of ironclad regulatory protection, 5 years as a new chemical entity and 5 years as an FDA qualified infectious disease product. So 10 years during which generics cannot do anything. Then, on top of these 10 years of regulatory exclusivity, we have patent exclusivity because our patent will last until 2035. And it's a patent on composition of matter, which is the strongest patent you can have for a product. So we have almost 15 years of exclusivity before generics will come in, and that will allow us to make ibrexafungerp the first representative of a new class of antifungals, a big, long-lasting franchise in antifungals. I want to stress another important point about antifungals. There are very few of them. Systemic antifungals are no more than 8 or 9 products that have been approved in the last 60 years, 60. And the last time that there was a new class was more than 20 years ago. Since there are so few antifungals have been always extremely successful on the market, with sales ranging from several $700 million to over $1 billion. So a product like ours, with its versatility, the possibility of being used in a broad range of infections, we expect to do extremely well. Just for vulvovaginal candidiasis, our first indication, we expect to have in the US alone net sales at peak of $400 to $600 million a year.
That's very impressive. And I understand Synexus has a very robust cash position or cash balance. You are well capitalized. Can you give me some specifics on that, please?
Certainly, David. So we just recently, actually in December, we had a financing. We raised $85 million. Was a very, very successful financing. We have some big players coming in with significant investment. And was actually at the end, we raised this $85 million with a relatively small group of investors. And this is because these investors came in because they saw the opportunity here with this financing to give us the cash that we will need to get to break-even point. And that means also that we expect that for a while we may not need to go back to the street for additional dilution. And therefore, what we are seeing right now, and like for example, the recent increase in our share price, maybe investors that are realizing that we are still significant undervalued, considering the potential of our product, and realizing that the only way right now to enter at this price point is really the open market. So we feel very good. We have about $100 million in cash that will allow us to cover our expenses beyond the launch. And as I mentioned, that is, we will start to see income coming in the second half of 2021 when we will launch our product.
Absolutely. And one more thing I just wanted to address about your treatment candidate. I believe that a broad label or wide applicability could pave the way to blockbuster status, really. We've seen this with other drug makers. So how would you, what are the different applications? Why should this be classified as a broad label type of treatment?
Well, it's a product. First of all, it has a broad spectrum. It works against many of the most dangerous fungi, like Candida, Aspergillus, Pneumocystis, Coccidioidomycosis, Histoplasmosis, and many others. So we can use it in a very broad range of indication, from vulvovaginal candidiasis invasive candidiasis, aspergillosis. We plan to use also in the future to develop it for prophylaxis of invasive fungal infection, which by itself can be an indication that can achieve by itself $500 to $700 million at peak sales in the US. So a lot of different type of indications where we expect our drug to do extremely well. There is also some, how can I say, an historic precedent. In the early 90s, so we are talking more than 30 years ago, I had just finished medical school back then, there was an antifungal that came on the market, fluconazole. It was a Pfizer product. And this Pfizer product, the characteristic of this Pfizer product was a broad spectrum, could be used both in the vulvovaginal candidiasis, could be used in the hospital setting. And the product achieved more than $1 billion sales back in the 90s. So, and fluconazole has been a workhorse in the field of antifungal for many years. Unfortunately, as we know very well now, pathogen and fungi are the same. Fungi, they develop over time resistance. So fluconazole, that has been an important product, to fight fungal infection in the last 30 years, is becoming less and less effective because more and more fungi are becoming resistant to it. Yeah. So there is the need for a new product that has a different mechanism of action than fluconazole, that is oral, that can be used in a different kind of infections in order to address all these type of conditions in different type of patients. And ibrexafungerp is that antifungal. Is that antifungal with a novel mechanism of action, a oral attributes, the broad spectrum, the ability to be used in many different conditions that made back 30 years ago fluconazole a success. So this is why we are optimistic that ibrexafungerp can have the same impact that fluconazole had 30 years ago when it was introduced. It's now time for a new product, and that product can be ibrexafungerp.
Yeah, it's really impressive to me the way Synexus is addressing a difficult to treat class of infections with a high mortality rate, and it's really underappreciated in the medical community, and I believe that there is life-saving even potential here. This is huge, and it's huge for investors as well. I want people to check out the stock if they want to on the NASDAQ exchange SCYX, and I want you to go to synexus.com because I don't want anyone to even consider investing in something until you have researched it yourself and you're really happy with the company. I'm very happy with the company. I've been speaking with Dr. Marco Taglietti, President and CEO of Synexus. We're going to have to check back with you soon when you've achieved many more milestones. I'm looking forward to that. So thank you, sir, for coming on looking at the markets. Thanks a lot.
Thank you very much, David. Thank you.